The NHS is drawing up new plans for cuts to frontline services across England to try to close a major shortfall in funding. That's according to an investigation by campaigners from 38 Degrees Group. They say if no cuts are made, the NHS could be facing a deficit of £23 billion by 2021. Well, let's go live to Westminster and our reporter Harriet Hadfield. Any more information as to what these cuts will involve?
Yes, well, this is the surprising thing, really, is that this information is, I think, much more has much more impact potentially on local communities than people thought. These are called sustainability and transformation reports, and England has been divided into 44 areas, and local NHS managers and doctors in those areas have been asked to look at what deficit they would predict in 5 years' time and then put forward proposals as to how they could make cuts and make savings. In some cases, it's actually, some of the proposals are to close hospital departments, to lose beds in hospitals. This information has come from the campaign group 38 Degrees. They commissioned an investigation to try and find out what was in these reports, because they said they found it all quite secretive and they thought that people, patients, local people should have access to what was being considered. Some of the information I can give you, for example, the Midland Metropolitan Hospital proposed closure of the A&E department in Leicestershire and Rutland, a reduction of the number of hospitals from 3 hospitals to 2 in that area. And it's not just hospitals. We also understand that GP surgeries could be restructured, and also some mental health services could also have some form of reorganisation, what some people would say are cuts. We have spoken to the communications director of 38 Degrees, and here's what she had to say.
I think the scale of the proposals across the country is frightening and certainly worse than I'd expected. To think about hospital beds being closed and A&E wards being downgraded, if I was caring for an elderly parent or a new mum or depressed, that would be very scary for me to hear. I think, though, it's not particularly surprising to realise that this is the reality of the NHS funding crisis. When you look at the deficits that NHS leaders are being asked to close, when you look at the fact that NHS funding has been squeezed for years, this is the reality of the choices that they're having to make.
Well, we know the NHS is under a huge financial pressure. Ageing population, more demands on its services. Also, they have some staffing shortages, problems with recruiting into the workforce. NHS England has committed to save more than £20 billion in the next 5 years. So they do need to find that money, and the government has given us a statement saying that it is playing its part. It says, we have protected the NHS by giving it an extra £10 billion to fund its own plan to transform services. Changes to local services will only go forward where they are designed by doctors and in the clear interests of local patients. You could say that some restructuring could be a good thing. It could allocate resources, doctors to other centres and make them better places for patient care. But if you live in a local area and you are reading for the first time that perhaps you're about to lose some vital frontline services, I don't think this will be very popular, and I think we will see some local political battles, and it puts Jeremy Hunt under new pressure just after the junior doctors' strikes. OK, Harriet, thank you. Well, joining us live to discuss this is Dalton from the NHS Confederation. Very good afternoon to you, Mr. Dalton. Thanks for joining us at this lunchtime on Sky News. The group 38 Degrees say they are deeply concerned by the scale of these proposals.
Well, your report rightly focuses on the very serious problems around finances in the NHS. But there is another issue which is really driving this work locally, which is to do with demand on the NHS. We have a growing elderly population, and the good news is we have medicine now. It's so advanced now that things that were life-threatening in the past are things which now can be more effectively dealt with. What that means, though, is that we need to think about the demand on the NHS and what our local leaders, not only in the NHS but in have been working together locally on thinking about what proposals that they put before local people around how the NHS might be sustainable going into the next 10 and 20 years. I'm afraid we've tended to dodge this question for far too long now. And it's now the pressure on the NHS and on local government, on social care, is getting so great that we can no longer put this off to another day, and now is the time when we need to address this question.
Mr. Dalton, there'll be a lot of people watching this interview right now, and they'll be saying, well, how did we get ourselves into this position where by 2020 to 2021 there's a £20 billion shortfall in funding for the NHS?
Well, the shortfall is mainly on the basis of predicted demand on the NHS. We have growing costs around drugs. We have now some brilliant but very expensive treatments that are available, and quite rightly citizens of this country want access to those things, and we can predict that the demand is going to mean that there will be an exponential growth, a continuing growth of costs for the NHS. And therefore, that's what we're trying to get ahead of, and that's what all these local conversations are about. And they're not happening in isolation. Those conversations will be taken to the public. In many cases, the process of talking to the public has already started. But nobody's going to, you're not going to wake up and find that your local hospital is closing. There will be conversations about how we organise care, where care is delivered. I'm afraid that the way in which we've organised care right now, the way in which it's distributed in any community right now, can sometimes be an accident of history rather than something that we planned. We can't go on like this, and we need to get together across local government and across the health service to determine what kind of health service is needed locally, and that can't be designed in London, in NHS England. That has to be designed locally. So there are 44 community-based conversations going on, and they will soon be opened up to the public, and that's what local leaders are working on right now.
If you look at some of the changes that we're talking about here, hospital beds going, some A&E wards being downgraded, meaning that potentially some people may have to travel even further to get to an A&E. This could be the difference between life and death, couldn't it?
Well, in any of the plans that we are designing, we will be looking very carefully about the consequences for local people and making sure that safety is right at the top of the list. I'm talking to you from Cumbria right now, and this is an area where it is enormously difficult to design care which is close to all the communities in a very vast county. So safety is the top of the list in this community when designing healthcare. And when looking at access to healthcare, particularly access to emergency services, that will be at the top of the list of consideration.
This does once again add fuel to this debate about whether we can have a successful, effective 7-day NHS, doesn't it? Well,
the desire for a 7-day NHS is something which is understandable, but paying for a 7-day NHS is another issue. You know, much of the conversation about NHS care is focused on the A&E department and on emergency care, but the real growing demand on the NHS is actually around long-term conditions. It's around issues like diabetes. It's to do with conditions associated with growing older, like cardiac disease and lung diseases. Things which actually are driving up the costs in the NHS and in social care. It's looking after people who are living longer and not dying of those long-term conditions, which is driving up costs. So whilst I understand the focus on A&E, on emergency care, on access, on 7-day services, these are things which people worry about. But actually, the majority of the costs are in the long-term conditions that I've just referred to.
OK, Stephen Dalton.
The way in which we organise those things that are important.